and welcome everyone to episode 4, Coronavirus Continuity Planning. I'm Walt Laskos, and I'm delighted that you're able to take some time to join us for this important call today, where we will look at a lot of implications of the pandemic as it currently stands, how it can impact us from a psychological level, as well as from an HR perspective. And also, let's not forget from the local level of how we're working and serving members throughout all our credit unions. Before I introduce the panelists for today's program, I want to first call upon the President and CEO of the Cooperative Credit Union Association, Ron Maclean, for his opening welcome. Ron?
Thank you, Walter, and good morning, everyone, and welcome to today's web conference call. Thrilled to have you join us today. As I always say, I want to make sure I express that we hope that you and everyone at your credit union is healthy and well. We have a great lineup today. We have two outstanding CEOs to share some best practices. We have an HR expert from the Employers Association of the Northeast. A reminder to our members that the association has partnered with the Employers Association of the Northeast, and that allows all of our members to have access to their HR hotline, which many have been utilizing the past few weeks. And finally, thrilled to have a professor of psychology, Dr. Linda McKenna-Goulin, on the call today. So again, enjoy today's web conference call, and back to you, Walter. Thank you.
All right. Thank you, Ron. Now let's take an opportunity to do a little housekeeping here before we introduce the panelists. Remember that this session today will be recorded. It will be archived, and a link will be provided on our coronavirus website, on CCUA's website, that is. And in addition, I also invite and encourage any questions you may have, for Dr. McKenna-Goulin or Mark Adams or Sean Daly or Blanche Jackson, by simply sending an email to communications@ccua.org. Again, that is communications@ccua.org. Now let us introduce the panelists. We have with us today Dr. Linda McKenna-Goulin. She's a professor of psychology at Marymount University. We have Mark Adams, who's a director of HR services for the Employers Association of the Northeast. Sean Daly is with us. He's president and CEO of People's Credit Union in Middletown, Rhode Island. And we also have Blanche Jackson with us. Blanche is president, CEO of Stepping Stones Community Federal Credit Union in Wilmington, Delaware. Okay, let's get our conversation going. Let's hear from the experts, and we'll start with Dr. Linda McKenna-Goulin. As I mentioned, Linda McKenna-Goulin is a PhD. She holds a PhD. She's a professor of psychology at Marymount University in Arlington, Virginia. Dr. McKenna-Goulin earned her PhD from the University of Pennsylvania and conducts research on autism spectrum disorder and other disabilities. She's a regular speaker and presenter, called upon frequently by the news media for interviews relating to topics such as bullying, aging, and helping children and families cope with stressful events. Dr. McKenna-Goulin is also the parent of 2 sets of twin sons, and she joins us today courtesy of Comprehensive Benefit Administrators. Doctor, pleasure to have you with us. I'm going to turn the mic over to you, and we're ready to hear your words of advice on how we could begin to calm down much of that stress that perhaps we're feeling now that it's been like 3 weeks, 4 weeks maybe, that we've been kind of on lockdown.
Yes, indeed. Good morning, everybody. I'm delighted to join you and to bring to our discussion today the psychosocial aspects of the situation we're all experiencing. And there are some things that are pretty unique about this compared to other stressful events that we might have gone through. And then one of them is that this is a time of uncertainty. This is a unique threat to us, a unique problem, and the outcomes are not so clear. And here's the thing that we all tend to do. We all tend to focus on the negative outcomes or the potential negative outcomes, which is I will say, as a psychologist, is natural and normal because, when we're looking at any kind of negative threat, we have this urge to survive. That just sort of fuels our instinct to protect ourselves. And so what we try to do in that sense of a threat is we try to exercise control. What's tough about it is it's difficult to control this because the information is coming at us fast and the consequences are hitting us all the time. So what I want to say to everyone and to share is that we need to hang in there, because that lack of control that we have will fuel even greater stress. And that stress can lead us to do things that could be irrational or too quick. So what I want to start by advising is to hold off on that and recognize those negative emotions. They are natural, they're normal, and they're self-protective. And we just need to hang in there and and just wait to see how this plays out, and hold off on making big decisions, hold off on responding in ways that could set us back a bit. So anyway, I'd like to come back to some of these themes, but anyway, I'm delighted to be here and happy to help you with any advice I can.
Doctor, I think, when you consider a lot of the stuff that we're dealing with, we may have listeners who are at home, who are trying to work, they have their children. They may also have elderly parents or grandparents living with them. I guess my question would be, you talked about times of uncertainty, and I think about elderly folks who really are looking probably more for consistency of schedules, of what to expect, no surprises. Are there ways to be able to cope with dealing with individuals that are really looking for that type of stability in a time of uncertainty?
That's an excellent question, because a lot of us are a little bit more vulnerable to that. I think you mentioned in my introduction, I have a son who has autism spectrum disorder, and in his disability, the idea of routine and predictability is essential. But it's not limited to people who are older or people who are a little bit more vulnerable. I think we all need that sense of predictability and structure, all of us. Mm-hmm. Even those of us who think that we've 100% on top of things. And the audience today, my guess is a lot of us are used to having a lot of control of our professions, control of our day-to-day lives. We have very high achievers around here, and we're used to that. And what's doing here is it's throwing it all up in the air. So coming back to what we can control. There are things we can. For example, we can protect our families. How do we do that? Well, it's to stay put. It might not seem like a giant thing that we're doing. To those of us who are used to exercising a lot of control, but we can stay put. And we can protect ourselves that way. We can check in with those of us who might be vulnerable. So maybe if it's an older person, how are you? What about a child, a teenager? I have 4 teens, and I do check in with them more than I used to. So we can exercise some control, maybe not what we're used to, right? But we do have a degree of control over this, and that we should realize that and make use of that.
Do you think in an age today where social media is so prominent, Facebook, Twitter, and I guess I'm showing my age by just looking at those as opposed to some of the other types of platforms that the younger folks are on these days, but that whole world of social media, is that having a negative impact perhaps on how people might be dealing with this current crisis, or do you find it as maybe a channel that's there that if it's used properly, it could be a source of comfort perhaps to folks?
Great question. And we need it. Okay, we need it because our access to face-to-face people is really limited now. So we need to make the best use of social media. And showing my age, I will admit it's been clunky for me. For example, because I'm a professor, I now have had to automatically change all the work I do to online teaching. So I do all my online teaching to my psychology students who are all 18, 19, 20, and they're used to it. And they just jump right in, but it's been clunky for me. But that's just an example. So social media can bring a lot of positive to all of us, and especially to younger people who get a lot of comfort from that. Younger people like teenagers or college-age students who are used to being connected, and they're very facile with that. So I say, and then we can all learn from it. So there's a positive to it. On the other hand, that we have access to a lot of misinformation or catastrophic information or just outright incorrect information. And so that is a risk that we're looking at information that is fueling our fears or is just plain old incorrect. I recommend to my own family and to everyone out there who's listening today to look at very reliable sources, such as the Centers for Disease Control. In preparing my presentation today, I looked at the information provided by the American Psychiatric Association or for the National Association for Mental Illness. So those sources that provide solid information. Our presentation today is solid information from experts. So we have to be careful of our tendency to just look at anything that pops out that grabs our attention. Look at reliable, tested information, and don't spend all day on it. So spend some time baking another batch of brownies with your family or for yourself, and use social media where it can provide social support, but be careful of it fueling more fears.
Beautiful. You know, I think you just walked me down to one more question I had before I move on to Mark.
Sure.
But you know, I think it comes down to being fluid. You know, we hear about people talking about this pandemic and the pathogens being so fluid that they're constantly changing, and the information we have on them, what we're learning, trying to discover. But I think when we come to the situation we all find ourselves in, we have to realize that, you know, like you say, we have to control the situation. We can't let it control us. And I think that comes down to being flexible, being fluid, you know, and being open to being comfortable in the situation that we may find ourselves in right now, be it that we're working from home, that we have the kids climbing around or things of that sort. Are there any tactics, exercises, meditation or things of that sort that maybe we should be mindful of in the circumstances that we find ourselves in right now, that maybe these are like, you know, we talk about physical exercise, there's also mental exercise, and maybe there's something we could all be doing that can make this be a much more pleasant type of an experience, so to speak.
Absolutely, I agree. I am not a meditator. So if I said, okay, I'm going to start my meditation, it's not going to work for me. But what does work for me? You know, so you have to find what works for you to help to relieve those negative emotions and to be a good, healthy distraction.
Maybe it's listening to Pink Floyd.
Absolutely. I like to bake. So any of those things that work for you, I'm a big exerciser, so I'll take one of my sons with me and we go and we walk a couple of miles. So whatever works for you, go to that. I want to warn people against going to things that relieve stress but on a temporary basis that might cause more long-term harm. For example, people who tend to abuse substance. That's a vulnerable population, and that's someone those are people we need to, to reach out to, because sometimes what we do is we go to sort of negative methods of relieving stress that will only make us suffer a little bit more. But I also believe in adequate sleep and shut down when your body naturally wants to shut down, and if you're waking up when the sun comes up, get up. So those are pieces of advice I can offer. But again, they're individual, and I can't give a general, this is what you do formula for everyone. But I do agree, find ways of relieving that stress.
Beautiful. Thank you, Doctor. I appreciate it. We'll come back to
You're
you,
welcome.
but we're going to move on to Mark Adams now. Mark leads the HR Solutions team for Employers Association of the Northeast, providing services to member companies and directing programs for affirmative action, background checking, and data surveys. A frequent writer and speaker throughout the region, Mark guides management level and C-suite professionals on topical issues ranging from drug testing to FMLA to employee versus independent contractor laws. Mark is a graduate of the Catholic University of America in Washington, D.C., and the Western New England College School of Law, where he obtained his Juris Doctor in 1992. Mark, good to have you back with us again. You were on the call with us back on March 11th. We're already into the month of April. We're still dealing with all that we're dealing with the pandemic. And I would imagine since that March 11th date to now, a lot of things have changed in your world. You're probably on the go 24/7 dealing with your clients that are coming to you with questions. We appreciate you taking time to be with us this morning, and I'm going to turn the mic over to you so that you could give us an update on what you see going on thus far. Mark.
Well, thank you very much, and good morning, everybody. First of all, I just want to echo some of those earlier remarks as far as really the need for people to really kind of have that opportunity to take a step back, take a deep breath, get their frame of mind in order, and really not get too embedded with this. And I think that's one of the general observations that I would make when it comes to what I'm seeing with the companies we're dealing with. It seems like it's always front and center in the news. We're hearing continuously about the change in numbers and more cases, and that is creating a lot of stressors for companies. Certainly credit unions, because many of them have to operate because they are often exempt from, state stay-at-home orders and otherwise. I think HR professionals are contacting our offices and venting regarding the pressures that they're facing on the front lines, trying to operate their credit unions, service their members, while trying to alleviate the angst and anxiety that many employees are putting on them of having to come to work when their family members, or if they're working in two-income households, them being able to stay at home and really taking on that burden of knowing they have to go to work because of that. And it really creates a lot of challenges on the messaging that comes with that in terms of trying to be proactive in allaying some of those concerns by virtue of being proactive with their safety and hygiene practices to make work environments as safe as they possibly can be when they are engaging their members in delivering of services, to try to debunk some of the myths and misunderstandings regarding what their rights and options are with what seems to be an ever-changing number of federal and state directives that can impact credit union operations. We've even seen this week guidance be put forth both by the IRS and most recently, late yesterday, by the Department of Labor on the further implementation of the Family First Coronavirus Response Act, otherwise known as FFCRA. And with that, the expanded family and medical leave reasons and emergency paid sick leave reasons that many of the employees of credit unions now are going to be able to take advantage of that came online April 1st. So while credit unions can certainly operate, they are going to be facing challenges with employees that might be prepared to go out under those laws. And we're seeing a lot of companies trying to be as flexible and as adaptive as they possibly can with those needs, so that they can try to accommodate those leave requests the best they can without having people go out en masse in a way that might impede their ability to deliver services for members. So it is forcing management and HR professionals in credit unions to be more agile than ever, to be more flexible with their policies, and do so in ways that do not take themselves out of compliance.
Excellent. Thank you, Mark. How challenging is it when you think about it? Because right now, the Cooperative Credit Union Association is serving members in New Hampshire and Massachusetts, Rhode Island, and Delaware. A lot of the HR, let's say, regulations, how much are they being impacted by local, state mandates, regulations that each of us might be having, as opposed to something that might be more on the federal level?
Well, the requirements that are coming to bear, effective yesterday, actually, I think affect credit unions pretty much regardless of the state they're in. A lot of states have put into effect stay-at-home remote work orders, but for many states, because of who credit unions are and what they serve, a lot of times they're often exempt from those state obligations. So that kind of equalizes some of the differing state treatments that other industries might face in other sectors. However, getting back to then the federal implications that come with FFCRA coming online, it is forcing credit unions across the board to understand that they're going to have to adjust their attendance policies, their leave policies. If they're over 50 employees, having to deal with family and medical leave administration a little bit differently than they've been accustomed to in the past. I know for us as an organization, engaging credit unions and engaging companies, you're going to have some companies that are below 50 employees that are going to be more challenged dealing with this because they've never had to deal with the type of leave administration that these laws are going to bring on them. And that's going to be a little bit differently than companies that are over 50 but under 500 employees that have to balance their family and medical leave requirements versus these new laws. So it is creating greater challenges. By and large, unless otherwise exempt, and that's a whole different conversation for smaller businesses under 50. There aren't any hardship exceptions categorically for companies over 50 that they could take advantage of with this. So what that really is going to mean is companies need to be more prepared to have a workforce that is more flexible, because if people do have to step back and step out due to childcare situations now, with schools and childcares being closed due to state orders, they now have the ability to stay out for a prolonged period of time with job protections, and a company's going to have to work around that. And if you've got a workforce with employees with a lot of kids, are you prepared to adjust and tack and move people around to continue to deliver those services due to that type of situation or some of the other COVID-related sick situations that would allow for other time off to be taken too? So I think, just in summing it up, I would say I've been with the association for over 25 years. I would say this coronavirus situation and the orders and laws that have come from it are forcing companies to be more flexible and agile now than ever before. I would say we are now operating under a legal and regulatory climate in response to this that is evolving in an unprecedented rapid way, just because this condition is evolving in such a rapid way too. And I think we're all trying to work through this together. Even the Department of Labor, the IRS, and state agencies literally we're finding agencies coming out with new guidance almost daily. And again, that's just putting another stressor on both employers and employees alike as they try to adjust their professional and personal lives.
Interesting. So, when I think about larger asset-sized credit unions, the resources are there with their HR staff, that sort of thing. But I oftentimes wonder about the smaller shops, the smaller asset-sized credit unions that may not be so large. What might be some guidance that you would have for them, for the CEO in a shop like that is confronted with all of this that's going on? Is it to not make a move until you talk to legal counsel that you have on staff, or what would be like the first couple tips or steps that anyone should take within that type of a setting in dealing with this on an HR level?
Well, and I think it depends on what aspect you're talking about on this subject. I mean, if you're talking about concerns with safety or employees that might have had exposures or something of that nature, that's certainly going to be one dimension where, whether it is dealing with in-house counsel, dealing with a resource like us, or dealing with someone that's got a safety background, would certainly come into play when it comes to working them through, well, how do you deal with the risk assessment? What is the level of exposure? How do you formulate responsive communications that are proactive and transparent to the degree you need to be able to make those adjustments as needed, to adjust and manage those issues? And then there is the other aspect, and that is, okay, if there has been a decline in, business and engaging members, what are you going to do with that? Are all the branches going to stay open? Are you going to reduce staff in branches to, channel business to more of a virtual or electronic ATM sort of thing? And what path makes the most sense with that? Are you talking just temporary furloughs? Are you going to allow people to take paid time off? Are you going to work with, state programs that might be in certain states for shared work or work share programs as a way of augmenting pay if there are going to be reduction of hours to be had? And unfortunately, that's different from state to state. And the point I'm making with all of those are all different strategies. And it's not a one-size-fits-all as far as what strategy makes the most sense for a given credit union. So with that, I would say that even for the smaller credit unions out there, the ones with more limited resources, it really requires a deeper conversation with them to really get a sense of knowing how their members engage them and what is the right course of action to strike the balance they need to.
Exactly. And I would also think, Mark, share with me what your thought is, that it's important for CEOs in shops like that of smaller assets. One good ace in your hand is your colleagues at your neighboring shops that of peers, listening to them, being in communication with them as well. By all means, we are a cooperative system. So hearing with others,
Exactly.
what others are doing, that also helps to provide guidance.
Exactly. And, we've been doing periodic surveys even with our members as well, as far as what are the strategies they're taking, and it truly is mixed all over the place. I think one of the other things, and it goes to the previous comments, and that is you got people who are coming to work, and many of them are afraid because of what they're seeing and what they're hearing. And despite a company's best efforts of putting their best foot forward with promoting the measures they're doing and keeping their employees abreast and empowering them with education from a safety, hygiene and perspective, you still have people coming to work concerned. And the question then becomes, how do you deliver those messages? I think it's important for leadership to be empathetic, have a level of concern in the delivery of those messages, so the feedback they're getting from their employees is not just falling on deaf ears outright. But the other piece is going to be moving forward. Our company's going to have to start thinking about, to the degree they can do it, maybe it is putting some additional incentives on the table and recognizing their efforts to come to work in this situation, whether it is some adjustment to their pay, maybe it is some additional bonus or compensation to do that. Surveys right now we've done that the vast minority of companies that we've surveyed have done, and only 10% so far. But as this marches on, if it does march on, that might be another option for people to think about that might allay some of those concerns. But again, that's going to be a question of what a credit union can afford to take on, and if that's an initiative they want to consider.
Mark, thank you so much. I want to remind all of our listeners right now that if you do have a question for Dr. McKenna Gulen or Mark Adams, who we just heard from, please send it via email to communications@ccua.org. That's communications@ccua.org. Don't be shy. Let us know what you're thinking. Let us know what you might need clarification on. We'll be more than happy to present those questions to our panelists. I'm going to move on now to take a local look at how credit unions are dealing with the current scenarios. We'll go first to Middletown, Rhode Island, to People's Credit Union. We have with us Sean Daly, who's the president and CEO of People's Credit Union. And Sean, I'm going to turn the mic over to you and welcome your comments, your guidance to your peers and to all of us, that are listening from all the different credit unions, as to how you are coping with this whole pandemic at your shop, and particularly as a new CEO coming in. And what are you finding that's really challenging? What are you finding that's works? We look forward to hearing from you. So, Mark, or Sean, rather, the microphone's yours.
Thank you. And I also want to thank CCUA and Walt for putting this event together. I appreciate the opportunity to share our story. I think when this all started, what the big thing, and similar to what Dr. McKenna Gulen talked about, we really were focused on identifying and focusing on the things that we could control on a largely uncontrollable situation as things were changing on a daily basis, how to focus. The big things we started off with was reminding our managers our expectations for them as leaders in the organization during difficult times, and really how important that would be for the staff. We explicitly asked everyone to step up, be creative, flexible, patient, empathetic, collaborative. We were also very focused on over-communicating to staff. We have daily meetings, random calls to staff at home. We have email updates, and we're doing branch visits and really making sure that we're listening through those. We also set expectations on decision-making. What needs approval? What can leaders run with? And making sure that we recognize there's criticality and timing when they're making these decisions, and the importance of bringing creativity to their problem solving. That was overall. And then when we went into the direct retail interaction, starting March 18th, we ended up closing our lobbies and so went to drive up only. And we're following those best practices around stopping the spread of virus with the hand sanitizer and cleaning the tubes and all the other pieces, and keeping separate whenever possible. But we also recognize that there is stress for our staff. So we are doing things like setting up EAP meetings. That's our employee assistance group, to talk about the stress of this and work with them. We also looked to build out a plan for the event of a branch closure, whether it's limited hours, having a traveling team, having branches serve nearby offices. So we're thinking, as this continues on, what we need to be working through. And then with the alternative member interaction, whether it's online or through social media, we're trying to bring relevant updates to our members. We're having the member service center the call center be assisted by the branch staff whenever possible. And really overall from a branch perspective, that's worked out well for us to this point. Operationally, we're 95% working from home now. And we've also been focused on looking at technology that we could deploy that would help us better interact. And one of those is Microsoft Teams that we've brought on relatively quickly. And, without really testing it, we just brought it out and people were able to, build it out their own way. And that's been really helpful for people staying communicated with. And then with overall helping our members, we're doing those things like skip-a-pay, mortgage modifications, pausing foreclosures, stopping repossessions of automobiles, and looking at, when there's situations with the fee waivers and the like, we're really trying to identify those areas and balancing that with the reality of, if this drags on for a while, there's capital implications that we're talking about and making sure we're thinking about those things at the same time. So that at a high level is what we've been focused on, Walt.
Oh, wonderful. Sean, I was going to say there was an article in the Boston Globe here about maybe a week or so ago. It was I want to say it was like an 87-year-old lady who was trying to go into the branch at a small community bank in the Boston area. And she, knocking on the door, can't get in. And there's a photo of her, of course, the way it was covered, where she's standing outside the branch and kind of frustrated that, she couldn't do her operations, which, of course, kind of blew my mind initially because I'm thinking an 87-year-old just walking down to the branch and doing all this, she's part of the most vulnerable age group that's, targeted by this pandemic. She shouldn't even be allowed to. But I think the point is made that there's a lot of maybe some folks that have their ways of how they do their banking and they're looking to continue those ways and not seeing that. Are you encountering any of that at your shop? With trying to serve those members that, let's say, sometimes need special care or special handling. Are you finding any challenges with that, or how are you addressing it if so?
Yeah, that's a great question. We are finding those challenges. We have people that have never used a drive-up before, and that's all age groups, but it's especially been stressful for some of our older members. I think the nice part is we've built a team in the retail side that is very empathetic and cares a lot about the members. And they've built relationships up. So, they'll see that member, and we make sure that we have somebody manning the door to help explain the situation and also help them understand what their options are for interacting with us. And we've had to be, help somebody walk through how do you actually do the drive up and be patient. And so although we've seen that stress, we've also, I think with the work that our team has done, have put our members at ease. And we've got people used to doing the drive up, and we have people walking to the drive up, and we're helping them out as well. So it's been, I think, those relationships and that culture that we have within the branches has helped alleviate that.
Wonderful. Thank you, Sean. Let's move on now, go down to Wilmington, Delaware, where we have Blanche Jackson. She's the president CEO of Stepping Stones Community Federal Credit Union. Blanche, I'm delighted that you're able to be on board today with us and joining this conversation. And just much like just hearing what Sean had to say, what he's dealing with up in People's Credit Union in Rhode Island, I invite you to also share what the experience is right now at Stepping Stones Community Federal Credit Union. How are you reaching out to members? How are you dealing with staff? And how are you dealing with some of the challenges that might be coming from this whole pandemic? So, Blanche, the mic is yours.
Great. Thank you so much, Walt. And I appreciate the opportunity to share this information with other credit unions on what we're doing here in Wilmington, Delaware. So first off, Stepping Stones is a small credit union. We're just over $2 million in assets. We have 2 full-time employees, one being myself, and we have one part-time volunteer who's actually a board member. So we already face the challenges of not having a lot of staff to meet our members' needs. And we have limited hours of operation, which in retrospect actually is helping us right now because our members don't expect us to be open all the time. What we've been able to do is we have a mobile branch that we've been using to handle our transactions for our members. In normal times, the branch goes around into the community, we open accounts, we can print instant issuance ATM cards from that van. So now we're using it to do transactions, still open accounts, and we can still issue cards without the member having to come physically into the branch. We have some members who still need to come in to do a loan application or things like that, and we're seeing them by appointment only. We're scheduling them 20 minutes apart so that once we're finished, we can sanitize the area before the next one comes in. Fortunately, we haven't had a lot of members who have come to do transactions. Maybe we're seeing 3, maybe 4 during the times that we're open, which is unusual for us. The other thing that we've done, we were working on our digital services, so we sped up that implementation. So now our members have access to home banking, mobile banking, bill pay. We're doing a P2P like Zelle and account-to-account transfer so that we can limit them having to come into the branch to do any of their business if they don't need to. Our members have ATM cards, so they have access to their cash outside of coming to us. We don't have debit cards yet, but that hasn't seemed to be an issue with any of our members. And then just recently, I've been working on an e-signature product so that they could digitally sign loan documents or account documents, again, not having to come in to the branch for those things anymore. We've implemented Skip-a-Pay. We've only had 2 members call so far saying that they were affected by work stoppage, which right now I expect that to be a bigger issue as the days go along. As far as our staff is concerned, we are here 3 hours a day on Mondays, Tuesdays, Thursdays, and Fridays. We're closed on Wednesdays, so we've implemented a work-at-home day on Wednesday. So that's pretty much how we're handling things. We haven't had any issues with members not being able to get us when they want to. We also implemented a texting feature. So if a member calls and we're not available, they can communicate with us through text. And we didn't have that before. So it's changed a lot of how we do business and made us bring in things a little quicker than we probably would have without it.
So one thing, Blanche, that I want to ask you, and I'm also going to ask Sean, is what are you doing to keep a smile on your face each day?
Well, we just know, I think for us, just knowing that we're able to help, you know, if somebody calls or texts or has an issue, just knowing that we are able to be here to help makes me smile every day.
There you go.
You know, we try to keep things light and lively in the office when we're here, but just being able to help because we're small. Mm-hmm. And being small, I was concerned that our members would, one, we're in the city of Wilmington, and building trust with the city and the members that we serve was a long time coming because the one credit union that they had that did serve the city, unbanked, underbanked, actually closed its doors years ago, and there was never another one to come into this space. So the fact that we're here, we're open and available to them makes me smile.
Wonderful. Thank you, Blanche. Sean, how about you? What do you need to do, or what are you doing that's keeping a smile on your face?
I think that interacting with the team, you know, we've got a really good group of people here that are dedicated to what we do. And, you know, we're a relatively new team, but I've been impressed at how we've all come together and stepped up. That gets me excited to get into work to help solve problems. And And I think also, the feedback we've got from members of how we've been able to step up and help them and that they can rely on us and the responsibility that brings, that gets me excited to come to work.
Sean, thank you. Well, we have about 15 minutes left in our program. I want to remind our listeners once again that if you have a question for any one of our panelists, please email us at communications@ccua.org. Please let us know whatever might be unsettling to you or an issue that you need an answer to from one of our panelists. Let us know what that is. Send an email to us, and we'll present it to them. I know that we do have a couple questions that have come in. I know that Ron also, our CEO, also probably has a question or two. So I'm going to first start it off by going down to Delaware. We have Carol Langeau, who's a CCUA communications expert, one of the individuals that, or I should say, the individual that puts together the daily CU scan each day for us. Carol, what question do we have from your end down in Delaware?
Hey, thanks, Walter. We actually had a couple of questions come in with the same subject matter. And Blanche, everybody wants to know, what is the texting platform you're using? What product are you using for that?
It's a Sprint, has a smart messaging, I think it's called. And Carol, I can send you more information on it, but it works with your telephone line, and you set up the message and the member calls in and they can either leave you a message or start a text conversation with you. We've just been using it now for about 2 weeks, and it's been very successful.
Anything more, Carol?
Thanks. Yeah, well, I was just going to say, thanks, Blanche, and if you send me some little details down, I'll include some information in the scan for everybody to catch on to it. Thank you.
I will send it to you today. You're welcome.
Perfect. We also have on board with us Donna Bevilacqua. Many of you know Donna. She handles all the social responsibility programs that CCUA puts on. Donna, you have a question for one of our panelists on from your end?
Yes, Walter. We have a question here from Mark. A credit union has an employee that has possibly decided not to come to work for the next 2 weeks due to a health issue, say asthma. Are they responsible for paying her for the couple of weeks, or would she be required to use her own personal time? The credit union's fear is that once she goes out, other employees may also follow.
Thank you for the question. The question to me, without knowing a little more detail, so I'm going to answer it in the context of adding some detail, and that is if this person has an employee coming to them just because they have asthma and nothing more, then certainly they might be eligible to use their own sick time that they might have under the company's existing policy, so to speak. If, on the other hand, the reason why they're coming is because the employee has indicated to the credit union that their healthcare provider is recommending they not come to work because they are at high risk of catching the coronavirus due to their asthma, then that would be a protected reason under the emergency paid sick leave law that was part of FFCRA that came online. And in that case, the employee could take up to 2 weeks of leave under that program, and the credit union would have to pay them their regular rate of pay in accordance with FFCRA up to a cap of $511 per day, not knowing how much the person's earnings are. That's an actual hard cap per day that a employer would have to be on the hook for. So probably would just be their employer or their regular rate of pay. So again, it depends on a little more detail as to whether or not it would be a qualifying emergency paid sick leave reason, or if it would be outside of that scope, but then it might be tied to using sick time or other paid time off that the company would have. One last piece on that too, by the way, if it is a qualifying reason under emergency paid sick leave, the employee has the unilateral discretion to decide whether to use that first. A credit union could not require them to exhaust their paid time off first before the use of emergency paid sick leave. So that is built into the FFCRA law as well.
Okay, thank you, Mark. Donna, any more?
Nope, that's it at this time, Walter.
All right, thank you, Donna. Let me check back with Ron Maclean, our CEO, see if he has any questions remaining.
Yeah, thanks, Walter. A question for Dr. McKenna Gulen. So, Doctor, maybe share some tips and maybe best practices for people on the call that might be a supervisor, manager, or CEO. Just the fact that their employees will look to them for kind of the, how they're handling the crisis and the message they're sending. So maybe speak to the leadership and things that they can demonstrate that will give confidence to their staff within their own credit union.
Okay, I agree that a lot of us look toward our leaders for guidance and some reassurance, and that's important. I think that it's okay for a leader to say, "I don't know," or "I understand how you feel," because of course in leadership, it's important that the leader is also empathizing and human and is able to say, "I'm not so sure about this," or "I will get back to you about this." So keep it like that. I also hope that people maintain a sense of optimism and this idea that, we are all responding to this and we're going to try to look at opportunities that we have to grow. And hearing this call, I'm truly moved by how each person contributing today has found opportunities to grow and to make their work even better and enhance what they already do. So long as there can be an emphasis towards, what are the opportunities, and also by being human with the staff, being human and say, we're all going through this, and I am with you on this, and we're all going to get through this.
Thank you, Doctor.
Sure.
We have about 5 minutes left in our program, and I think what I'd like to do is, once again, I'm going to ask each of the panelists for a closing comment or two as we wrap up. But I also want to extend my deep appreciation to all of them for taking time today, their valuable time to be with us for this hour and to share their insights and their expertise. Let's go down to Wilmington, Delaware first and get a closing comment from Blanche Jackson at Stepping Stones Community Federal Credit Union. Blanche?
Yes, thank you. I just want to thank you again for allowing us to participate in this. And my closing comment would be just everyone keep doing what you're doing, practice social distancing, make sure you're available for your members, and we will all get through this if we all do the things that the CDC is asking us to do. Thank you.
Thanks, Blanche. How about you, Sean? Closing comment?
Thanks, Walt. I think that for us, our decisions that we've been making all along have been really focused on the safety and health of our staff and members. And I think as things change, I would recommend, if you haven't been focusing on that, you should be. And as things change, which they have been on a daily basis, you have to recognize that you need to adjust, and something that made sense maybe 3 days ago doesn't make sense today, and that's okay. But staying on top of that's going to be really important as this thing continues to go through the system.
Thank you, Sean. All right, now let's go to Mark Adams. Mark, how about a closing comment?
Thank you very much. I would say that credit unions are going to have to remain vigilant in terms of being open to being flexible and adaptive in handling their employee situations, and really resist the temptation of taking a one-size-fits-all in the application of their policies and situations. as well as leadership and HR professionals continuing to stay on top of the evolving guidance and remain transparent with their employees on what they're doing with respect to that. I think if those two strategies are carried out moving forward, then I think it's going to really set credit unions apart when it comes to keeping their employees engaged, which I think will pay dividends long term when we come out of this situation.
Thank you, Mark. And finally, let's hear a closing comment from you, Dr. Linda McKenna-Goulin.
Oh, well, thank you. I appreciate being part of this conversation, and I would like to remind all of us that we are not alone in this. It might feel that way because we're isolated in many ways, but we're not alone. And what I've heard today is people offering each other concrete suggestions and concrete support. And so I would recommend that we do reach out to the vulnerable people in our lives and try also to help each other and to take good care of yourself.
Thank you, Doctor. Now let's go back to Ron Maclean, President and CEO of CCUA, for his wrap-up comments. Ron.
Okay. Yep. Thank you, Walter, and thanks, Walt, for pulling the event together. Excellent job. A big thank you to our panelists, Mark, Dr. McKenna-Goulin, and a huge thank you to our two CEOs, Sean Daly and Blanche Jackson. Thank you for the work you're doing every day to serve your members, but also your employees. And I guess my final comment is, as I heard the doctor talk in her opening remarks, in an uncertain time, there's some stress in people's lives. One thing they can count on is the confidence they have in their local credit union, somebody that they trust, and they go to you for something that's reliable, and you deliver time and time again. So in an uncertain world, credit unions play an important part in giving reassurance and confidence to people out there, and that's inspiring. So thank you.
All right, thank you, Ron. And again, one last reminder that this program is being recorded, and the audio of it will be archived and placed on the coronavirus resource page of the CCUA website. On behalf of our CEO, Ron Maclean, and Dr. McKenna-Goulin, Mark Adams, Sean Daly, and Blanche Jackson, I'm Walt Lascos. Thank you for joining us. Stay safe, stay well, and this concludes our program.